So for this case scenario, we had a psych patient who is a frequent flyer and was brought in by a police officer. Nurse number one was frustrated and did the usual giving the patient Haldol, and after the patient stated that she didn't want to take it, but took it anyway. Nurse number one had mentioned this to a coworker, which is nurse number two in this situation, and nurse number two has dealt with this patient before because this patient was a frequent flyer and offered to step in. However, nurse number two decided to use the Tidal model theory. So what nurse number two did was first ask the patient why they were in the hospital instead of assuming that they were here or what they were here for already. Still yet asked the patient. Then followed up with some questions asking the patient what the daily goal was. The patient responded not to hurt anyone. The patient also told nurse number two that they wanted to stop the Haldol and take Abilify instead. Instead of nurse number two disagreeing right away off the bat with the patient, nurse number two asked if Abilify has worked for them in the past and how it made them feel. After the patient stated that it made the voices go away. So then nurse number two told the patient that they would talk to the healthcare provider about it. The nurse asked for further ways to help improve the patient's recovery. The patient then thanked nurse number two and was more trusting towards this nurse rather than to nurse number one. So as I said, nurse number two used the Tidal model theory with these 4 steps included on the slide. Number 1, they explored and asked the patient what they needed. Remember that the patient is an expert on themselves. Number 2, the nurse number 2 respected the patient's autonomy as an individual instead of treating them paternalistically, meaning that they weren't limiting their autonomy for their own good. Number 3 was to develop goals and collaboration with the patient. And 4 was to focus on what the patient needs to be done and assist the patient without doing everything for them. So once again, like I mentioned, using the Tidal model theory is to help understand the patient more, especially when asking questions. We understand as nurses what they're seeing through their perspective, through their personal narrative. This helps us help the patient as nurses to the road to recovery.